The district's top doctor says monkeypox vaccines are expected to arrive in the city in the coming days. There are still no confirmed cases in our area, but with the disease spreading in other parts of the province, Dr. Janet DeMille hopes to start getting shots in the arms of those at high risk next week. Vasilos Bellos has more.
While the Thunder Bay District Health Unit has no confirmed monkeypox cases, there is some spread within the province that's concerning health officials. Currently, Ontario has had over 400 confirmed cases of the virus, and while the majority are in Toronto, health units across the province and country are preparing to receive vaccines. As local medical officer of health Dr. Janet DeMille explains, shots could be administered in Thunder Bay sooner rather than later.
I'm hoping within days we'll have the vaccine, and then any further guidance from the ministry with the use. And I've challenged my team to start administering it next week if we're able. So if everything works out. So that's the time, that's the, sort of the ideal timing.
Once the district receives monkeypox vaccines, they will initially be available to high risk groups. Dr. DeMille is saying the exact guidelines are determined by the Ministry of Health. At this point, almost all infections, around 98%, are in adult men who have sex with other men. Dr. DeMille also notes that Ontario has been vigilant in tracking cases and preventing spread so far, which is why the number of infections is still relatively low. Despite this, she stresses the district must remain vigilant as the issue is getting out of control in places such as the United States.
We know that if it's out of, not well controlled in other areas, and I always look at Minnesota, for example, as well as other areas around here, it is a bit concerning about where this could go, but certainly I think we're in a reasonably good situation right now, and we will adjust accordingly going forward.
Dr. DeMille says once the health unit receives monkeypox vaccines, they will be more than capable of rolling them out to high risk groups. The shot will then open up for others as the district receives more vaccines and has a better understanding of how the virus spreads. Vasilios Bellos, TBT News.